Welcome to our module on physical activity. Grant has carefully put together a series of videos designed to be able to be used by anyone, even if you've never done any regular exercise before. But before we move on to Grant's videos, we thought we'd take a few moments to chat about why being active is so important.
It's important all the way from childhood, through adolescence and adulthood, and into our old age. Number one on the list of reasons for being active is that it helps increase your life expectancy. Now that's a good reason to move. It's thought that people who are moderately active for about 2.5 hours a week reduce their risk of dying by about 1/3, compared to people who aren't active at all. Moderate activity would be something like walking at a brisk pace.
Some illnesses that you're less likely to develop if you exercise are heart disease, stroke, obesity, high blood pressure, type 2 diabetes, and a number of different types of cancer. And if you do have type 2 diabetes or high blood pressure, it's more likely to be well controlled. From a mental health perspective, we know that being physically active also reduces anxiety and depression in kids, teenagers, as well as in adults. Being active improves your quality of life overall.
In children, it improves brain function, body weight, and it helps build strong bones. If you're pregnant, you're less likely to gain an excessive amount of weight, to develop pregnancy-related diabetes or postnatal depression.
It's so important in the elderly as well. If you're elderly and you're active, your balance is likely to be better. You'll also be less likely to develop thinning of the bones or osteoporosis, which means that if you do fall, you're less likely to injure yourself. On top of that, you're less likely to develop depression and Alzheimer's dementia or to need carers to help look after you.
Exercise also helps you sleep better.
It's important to mention that people who are overweight or obese get benefit in terms of their health just as much as people who aren't, even if they don't lose weight.
So how much physical activity should we be doing? Well, national guidelines recommend that we do 150 minutes of moderate to vigorous exercise a week, as well as muscle strengthening activities on at least 2 days. That seems like a lot if you're someone who doesn't exercise. It's almost enough to put you off trying.
That's so true, and what's really important to say is that any exercise is better than none. There's clear evidence of health improvements even at low levels of activity compared to someone who does nothing at all.
And you don't have to do it all in a half-hour or 1 hour long session. A 5 or 10-minute walk is better for your health than no walk at all. You can do several 5-minute walks a day. It all counts. It's also about incorporating activity into our daily routines, as well as specifically setting time aside to exercise.
Have you heard of sitting disease? It's a modern day phenomenon where we drive to work, sit at a desk all day, drive home and then watch TV all evening. On average, we spend half our waking life sitting, and we're becoming more aware of how unhealthy it is to sit so much. Going from sitting most of the time to moving around even a little reduces risk of developing all the conditions we have mentioned already.